Thank you very much for the invitation, Gertrude and the Multi-Health Network and the team. And I was very interested to hear about the EU Compare project. Certainly, we'll work with you to promote it, and so process well done. So our remit at Health Promotion and Disease Prevention is to actually take a step back and see what's causing disease and how we can prevent it. So the steps we can take. But apart from that, one of our roles is to help people living with chronic conditions to live the best quality of life possible. So I'm going to tell you about the self-management program that we deliver. It's called WHO Control. This started before COVID. We had to stop during COVID because we were doing other things. But now again, we are starting to take it forward and deliver it, and we hope to increase the numbers attending. So first of all, we've already heard a bit about self-management with relation to diabetes. But in reality, self-management, you can say it's a continuum. So these are two definitions which are used. So self-care is taking responsibility for the health of yourself, your children, and family. Self-management is the active participation of patients in their treatment to minimize the impact of their condition. So you can see it as a continuum. At one end, here is pure self-care, what the individual is doing, so daily choices we are making, lifestyle, self-management ailments, so when we have a bit of a cold and so on, maybe we go to speak to the pharmacist, minor ailment, and then, of course, the longer-term conditions, which start taking more time and have more effect on our quality of life. Then again, we go into the acute conditions where you need to be admitted to hospital, compulsory, for example, psychiatric care, and major trauma. And here you have one is healthy living, minor ailments, long-term conditions, and in hospital care. So, as you know, people with chronic conditions spend a long time taking care of themselves in the sense. Maybe you go to your doctor or your nurse a few minutes every year. If you look at how much contact you have with your health professional every year, the time is quite short. The rest of the time, you are responsible for yourself. There are many benefits, of course, that we know about our condition, that we're empowered, we're active patients, and so on. We're more able to participate in decision making. We're increasing what we call our health literacy. So health literacy isn't only about knowing how to read and write. It's about understanding instructions given to us. It's about being able to take action. So health literacy is a complex concept. And when you're self-managing, you're learning and improving your health literacy. You're preventing ill health, you're promoting good health, you're improving your mental and physical well-being. It changes how people see themselves. It changes how people use the health service. So apart from the person, the health service will also benefit from more and more people becoming more health literate and improving their management. As well, it means that when something serious is wrong, you recognize it and you take action, which is, of course, important in certain conditions, that you do not procrastinate, as very often happens, and you're able to take care of yourself when you have a long-term condition. Now, these self-management programs first were put together in Stanford University in the USA in the mid-1990s. So there is a long history. They are structured, which means it's clear what you're going to do at every stage. And they studied self-management for arthritis, heart disease, lung disease, or stroke. And in fact, they carried out what we call a randomized control trial. So they had patients with these structured programs and patients who received normal care, and they looked at the health outcomes of these two groups. They found that there were benefits both for the patients and both for the health service. So in fact, this is the reference 1999, and the key person is a lady called Lorig. From there, the programs were disseminated all across the developed world. So in fact, now you get self-management programs all over the developed world. In 2007, there was a Cochrane review, which again established that there are benefits. Our program is based on the UK model. It was started as what's called an expert patient program in the UK. This is their publication in 2007, Kennedy and his colleagues, and they again found improvements and benefits for the patients as well as improving quality of life. But also they found that there are savings for the healthcare center services. So, of course, this is important in the real world unless you can prove that you're saving money. It's not only about improving patient care. It's easier if you can improve patient care, but also save some money. So in fact, what they calculated was that there were things which were reduced in patients who did these programs. So doctors' visits reduced, nurses' visits reduced. So this is 0.2 per person per year. But if you look at the number of people we have, for example, if we have 40,000 diabetic patients in Malta, I mean, when you start to calculate it, the sums really add up. It reduces hospital inpatient bed days, it reduces A&E admissions, it reduces outpatient appointments and medication costs. So they documented the benefits even in financial services. So what they calculated, total savings, 451 sterling per person per year. So quite a lot. Of course, this is under optimal conditions doing these programs. Anyway, so we had a project with a UK group called Self-Management UK. So in fact, this was one of our first group, and this is a recent group that we've done. When we started, we had to devise the Maltese words, and it wasn't easy. So we were looking around, self-management, what are we going to call it? And they told us the closest you can get is autogestione. Autogestione, Ticini. So it's true. I remember once I went on a radio program with a lady, I think Mariella, she was a commissioner for children, but she used to do radio. And she told me, "Issek ma tantx konfidenti bil-klim, jekk xi ħaġa," this was something new. The language, we had to find out what language we were going to use. And it was important to have standardized language so that not you say one thing and you say another, because these are standardized programs. So there are different things in the program. I'm going to take you through some of them. So this is the program. The program are group sessions. We deliver them free, and we deliver them in person, because one of the aims is that people help each other. It's extremely important that people actually help each other. We have 2 tutors running the program. We have a person who's a health professional and a person who is an expert patient. So Mary is one of our tutors from Aram. So we have people living with a chronic condition who deliver the program with the health professional. These are 6 sessions. Every session is about 2.5 hours. And this is the agenda for each session. So the main thing, these are soft skills that we want to impart. We are not going to teach you about diabetes or about arthritis. Of course, if there are questions, we will answer them. The group will contain people who have different diseases. Some might have asthma, hypertension, arthritis, etc. So there will be a different background to every patient. But these are skills which are the same for everyone. So important, we're trying to get behavior change. We know it's the most challenging things for us to achieve. How do you actually change your behavior? How do you, not eat a whole bar of chocolate, just eat a cube? How do you make sure that you go out and exercise regularly? How do you achieve that 15% weight reduction that you need to achieve to improve your diabetes control? They're very challenging. I mean, even myself from experience, I can say how difficult it is. So, part of it is setting goals. How do you set a goal? That's one of the things. And then things like relaxation we look at. These are the sessions, but I'm going to go through some of the key things that we do together. And every session, the group goes away with individual small action plans that they want to do. So I might be, I'm going to start buying vegetables and cooking a more healthy diet this week. And then you report back to the group, I found it difficult, I found it easy, I've decided I'm going to try and drink more water, and I managed. Our aim is to kind of establish a balance in life while living with a chronic condition. So again, we're looking both at factors to help you and factors which are difficult for us to live with. I mean, last group we had a lady with very severe arthritis who had severe problems going around and continuing her social life. So, we know there are people who are living with a great deal of disability and so on. So we establish our goals, but the goals have to be reasonable. We break the goals into smaller parts which are reasonable, and then we put our plan into action. And this takes, some people find this difficult. It's incredible, there are some concepts which, again, is part of improving health literacy. So this is piantazioni broken down into smaller bits. Like if I want to learn Spanish, that's a big aim. But how am I going to achieve it? Okay, I'm going to buy a book. I'm going to plan a holiday. I'm going to watch radio. I'm going to watch TV. So these are the little small action plans that are more easy to achieve. And by documenting them and having a clear map, maybe written or on your mobile, it's easier to help yourself achieve the behavior that you want. So small changes. Now, and they have to be smart. So we teach them smart, specific. What am I going to do this week? Exactly. It has to be measurable. Am I going to walk half an hour, 15 minutes? You decide, but it has to be specific, measurable and specific. Attivanti, is it important to you? If it's not important, and we ask them to measure on a scale from 0 to 10, if it's not 7, you're not going to do it. Forget it. Find something else. Unless it's important to you, you're not going to make the change. Okay? So this is it attivanti? Is it important to you? Is it realistic? I mean, if I tell you I'm going to go running 5 a.m. every morning, that's not going to be realistic for me. But some people it might be. So it has to fit your way of life. And then, ibbażata fuq il-ħin. What time of the day exactly? So I'm going to do this on Monday, Wednesday, Friday at 5 p.m. every day. I'm going to put it on my fridge. I'm going to put it in my diary. My alarm is going to go off. So If you break it down into small bits and do something like this, you're more likely to successfully change your behavior. So these are the things that we're doing. Then we talk about distractions, so helpful distractions. Let's say I'm a heavy smoker, I want to try and reduce. I need to distract myself to stop that nicotine addiction that I have, to reduce it. If I want to eat, you know, if I'm in pain, those sorts of things. If I'm having a lot of negative thoughts, how can I helpfully distract myself? So we'll talk about that. So there are two types. We talk about a doing type distraction and a thinking type distraction. So these are ideas and examples that we can practice to distract ourselves. Then we look into, for example, relaxation techniques. Okay, types of relaxation. We do more than these, but for example, pursely breathing is very simple to do. We can do it now. You all sit comfortably with your legs like that. Your hands on your thighs. Okay, relax. Now, breathe in through your mouth, through your nose. Hold it for 1 to 3, and then breathe out through your lips, as if you're blowing out a candle. So you can do this, you know, for a minute, and already your heart rate goes down. You know, so it's something you can do when you feel extremely stressed, whatever. So relaxation techniques is something we practice. We also practice mindfulness. Then self-talk. We understand self-talk. What is self-talk? We do a lot of negative self-talk, which is not helpful. You might tell yourself, oh, I'm so fat, I'm so fat, I'm so ugly. You know, you need to understand that you're doing self-talk. You need to stop yourself and say, what am I saying here? You know, because very often they go around in the back of our minds and they're not helping us. They're definitely not helping us. So recognizing the negative self-talk and then changing it and practicing changing it. How am I going to change it? So that's self-talk and how to change it into positive self-talk. So we can write down the talks, replace them with positive talk, repeat them in your mind, practice them in real situations. And practicing is the key to all this behavior change, because this is what we're trying to do. Then related to this, there is what's called positive affirmation, where you say positive things. It's like, you know, we are the champions. That's a positive affirmation. You can say it to yourself. We are the champions. We are the champions. So it puts a positive mindset to your mind. We talk about diet, of course. It's very important for us Maltese. So we have a session talking about diet. As we go through the program, we have a lot of resources. So Little Reflex, there are lots of resources that we give to participants. And sometimes they ask us, listen, for example, I can't sleep. Sleep is a problem. Okay, don't worry. Next time we'll bring you guides on how to improve your sleep patterns. So these are things, you know, people ask us for stuff and we help as much as possible. So of course we have, because we're health promotion, we have a lot of literature on healthy eating, Mediterranean diet. We have a lot of recipes which we give, etc. This is our healthy plate that we base our discussions on. We have a session on exercise. So these are colleagues of Mary. We had a little project with them. We explain, so exercise is a big thing. A lot of people think, no, I can't do anything. I can't do anything. It's going to kill me, it's going to damage me. So this is something which, you know, we give importance to. The benefits and so on. Tips about exercise and what you can do. Because even even 10 minutes for a person might be enough to help them get away, you know, start to improve. So every person will have a different and a different capability, but you can build up. So the more you keep physically active, both mentally and physically, you know, there are a lot of benefits. We discuss how to prepare for the health visit. You know, so if you're going to see your doctor once every 6 months, it's important you think about what you're going to ask him, how you're going to prepare. So we have a list of questions that we discuss how to get more out of the health visit. So these are some questions. We look at, for example, medications. You know, how to understand more what medications you're taking and so on. So these are some of the topics that are covered. We also signpost persons to our services. So we have we run a tobacco cessation service. This is the quit line on the tobacco package, which we're responsible for, and we give one-to-one counseling by appointment. We have a weight management program, Peace Tie-Up Tool High Tech. And we also now have a program working on helping people improve their mental resilience. We also discuss websites. So what are reliable websites is very important. A lot of people get information from Facebook and sometimes they're a disaster. So for example, our health promotion website has some information. CDC in America. It's got one of the best websites probably in the world, and they have sections with patient information, so with written in the language for patients, and the NHS UK as well.
Now we will have to compare.
And yes, definitely. Okay, so what I want to emphasize, these programs are free of charge. My colleague Phoebe has application forms, so if any of you want to apply, or else write to us. So you can either go on our Facebook page, Health Promotion Malta, tamlunna like, and you can send us a private message. Okay? So you can say, listen, I'm interested in the self-management program, and then we'll contact you with a date and a location. Okay? Thank you.
Thank you.